and maxillofacial surgery, OMS or OMFS, specializes in treating many diseases, injuries, and defects in the head, neck, face, jaws and the hard and soft tissues of the oral, mouth, and maxillofacial, jaws and face, region. It is an internationally recognized surgical specialty. In countries such as the UK, and most of Europe, it is recognized as both a specialty of medicine and dentistry, and a dual degree in medicine and dentistry is compulsory. In other countries including the United States, India, Canada, Brazil, New Zealand, Australia, Sweden, and Israel, it is a recognized specialty of dentistry. Regulations. In several countries, oral and maxillofacial surgery is a specialty recognized by a professional association, as is the case with the Dental Council of India, American Dental Association, Royal College of Surgeons of England, Royal College of Surgeons of Edinburgh, Royal College of Dentists of Canada, Royal Australasian College of Dental Surgeons and Brazilian Federal Council of Odontology, CFO. In other countries, oral and maxillofacial surgery as a specialty exists but under different forms, as the work is sometimes performed by a single or dual qualified specialist depending on each country's regulations and training opportunities available. Summary. An oral and maxillofacial surgeon is a regional specialist surgeon treating the entire cranio-maxillofacial complex, anatomical area of the mouth, jaws, face, and skull, as well as associated structures. Depending upon the jurisdiction, maxillofacial surgeons may require training in dentistry, surgery, and general medicine. Training and qualification in medicine may be undertaken optionally even if not required. Oral and maxillofacial surgery is widely recognized as one of the specialties of dentistry. In many countries, however, maxillofacial surgery is a medical specialty requiring both medical and dental degrees, culminating in an appropriate qualification, e.g. Fellow of the Royal College of Surgeons, FRCS, in the UK. All oral and maxillofacial surgeons, however, must obtain a university degree in dentistry before beginning residency training in oral and maxillofacial surgery. In the United States, oral and maxillofacial residency programs are either 4 or 6 years in duration. Programs that grant the MD degree are 6 years in duration. They also may choose to undergo further training in a 1 or 2 year subspecialty oral and maxillofacial surgery fellowship training in the following areas: cosmetic facial surgery, cranio-maxillofacial trauma, craniofacial surgery / pediatric maxillofacial surgery / cleft surgery, head and neck cancer microvascular reconstruction, maxillofacial regeneration, reformation of the facial region by advanced stem cell technique. The popularity of oral and maxillofacial surgery as a career for persons whose first degree was medicine, not dentistry, seems to be increasing in a few EU countries. However, the public funds spent for 14 years of training are of a major concern for governments. Integrated programs are becoming more available to medical graduates, allowing them to complete the dental degree requirement in about 3 years in order for them to advance to subsequently complete oral and maxillofacial surgical training. Surgical procedures. Treatments may be performed on the cranio-maxillofacial complex, mouth, jaws, face, neck, and skull, and include dentoalveolar surgery, surgery to remove impacted teeth, difficult tooth extractions, extractions on medically compromised patients, bone grafting or pre-prosthetic surgery to provide better anatomy for the placement of implants, dentures, or other dental prostheses. Surgery to insert osseointegrated, bone-fused, dental implants and maxillofacial implants for attaching craniofacial prostheses and bone-anchored hearing aids. Cosmetic surgery of the head and neck, rhidodectomy / facelift, brow lift, blepharoplasty / Asian blepharoplasty, otoplasty, rhinoplasty, septoplasty, cheek augmentation, chin augmentation, genioplasty, oculoplastics, neck liposuction, lip enhancement, injectable cosmetic treatments, Botox, chemical peel etc. Corrective jaw surgery, orthognathic surgery, surgical treatment and/or splinting of sleep apnea, maxillomandibular advancement, genioplasty. Diagnosis and treatment of benign pathology, cysts, tumors etc. Malignant pathology, oral and head and neck cancer, with ablative and reconstructive surgery, microsurgery. Cutaneous malignancy, skin cancer, lip reconstruction. Congenital craniofacial malformations such as cleft lip and palate and cranial vault malformations such as craniosynostosis, craniofacial surgery. Chronic facial pain disorders. Temporomandibular joint, TMJ, disorders. Dysgnathia, incorrect bite, and orthognathic, literally straight bite, reconstructive surgery, orthognathic surgery, maxillomandibular advancement, surgical correction of facial asymmetry. Soft and hard tissue trauma of the oral and maxillofacial region, jaw fractures, cheekbone fractures, nasal fractures, Leffert fracture, skull fractures and eye socket fractures. Anesthesia training. In the United States, oral and maxillofacial surgeons are required to undergo 5 months of intensive general anesthesia training. An additional month of pediatric anesthesia training is also required. The American Society of Anesthesiologists published a statement on the anesthesia care team which specifies qualified anesthesia personnel and practitioners as anesthesiologists, anesthesiology fellows, anesthesiology residents, oral surgery residents, anesthesiologist assistants, and nurse anesthetists. Laser applications in OMs. Lasers were first introduced to OMs in the mid-1980s starting with the CO2 laser. The CO2, carbon dioxide, laser remains the gold standard for the soft tissue surgery because of the ease of simultaneous photothermal ablation and coagulation, and small blood capillary hemostasis. The CO2 laser is used in oral and dental surgery for virtually all soft tissue procedures, such as gingivacomies, vestibuloplasties, frenectomies, and operculectomies. The CO2 laser's 10,600 nm wavelength is also safe around implants as it is reflected by titanium, and thus has been gaining popularity in the field of periodontology. It may be effective in treating peri-implantitis. In the UK and most of Europe, oral and maxillofacial, OMF, surgeons specialize in the diagnosis and treatment of diseases affecting the mouth, jaws, face, and neck. OMF surgery is unique in requiring a dual qualification in medicine and dentistry, and is often seen as the bridge between medicine and dentistry, treating conditions that require expertise from both backgrounds such as head and neck cancers, salivary gland diseases, facial disproportion, facial pain, temporomandibular joint disorders, impacted teeth, cysts and tumors of the jaws as well as numerous problems affecting the oral mucosas such as mouth ulcers and infections. Many OMF surgeons focus on one of these areas to develop a subspecialist interest within the scope of the wider specialty. In Australia, New Zealand, and North America, oral and maxillofacial surgery is one of the 9 dental specialties recognized by the American Dental Association, Royal College of Dentists of Canada, and the Royal Australasian College of Dental Surgeons. Oral and maxillofacial surgery requires 4 to 6 years of further formal university training after dental school, DDS, BDent, DMD, or BDS. In the United States, 4-year residency programs grant a certificate of specialty training in oral and maxillofacial surgery. 6-year residency programs grant the specialty certificate in addition to a degree such as a medical degree, MD, DO, MBBS, MBCHB etc., or research degree, MS, MSc, MPhil, MDS, MSD, MDSc, DClindent, DSc, DMSc, or PhD. Both 4- and 6-year graduates are designated U.S. board eligible, and those who earn certification are diplomats. Approximately 50% of the training programs in the U.S. and 66% of Canadian training programs are dual degree. The typical training program for an oral and maxillofacial surgeon is 2 4-years undergraduate study, BS, BA, or equivalent degrees. 4 years dental study, DMD, BDent, DDS, or BDS. 4 6 years residency training. Some programs integrate an additional degree such as a master's degree, MS, MDS, MSc, McClindent, MScdent, MDent, doctoral degree, PhD, DMSc, DClindent, DSc, or medical degree, MBBS, MD, DO, MBCHB, MDCM. After completion of surgical training, most undertake final specialty examinations, U.S. board certified, ABOMS, Australia/NZ, FRACTS, or Canada, FRCDC. Some colleges offer membership or fellowships in oral/maxillofacial surgery, Moral Surg RCS, M, OMS, RCPS, FFD RCSI, FABOS, FACOMS, FFD-RCS, FAMS, FCDSHK, FMFOS, SA. Recently, both single and dual qualified oral and maxillofacial surgeons are now also obtaining fellowships with the American College of Surgeons, FACS. Average total length after secondary school, 12-14 years. In addition, graduates of oral and maxillofacial surgery training programs can pursue fellowships, typically 1-2 years in length, in the following areas: head and neck cancer, microvascular reconstruction, cosmetic facial surgery, facelift, rhinoplasty, etc., craniofacial surgery and pediatric maxillofacial surgery, cleft lip and palate repair, surgery for craniosynostosis, etc. Cranio-maxillofacial trauma, soft tissue and skeletal injuries to the face, head, and neck. In Hong Kong, a master's program and an advanced diploma program are offered by the Faculty of Dentistry of the University of Hong Kong. Oral and maxillofacial surgery departments are available at public hospitals managed by the Hospital Authority.
Please subscribe and thanks for watching.